Okay. Thank you.
All right. We're rolling. Just a quick welcome. I just want to briefly say we've had, I think, 3 or 4 emails already go out to the club this week. So let that be your sort of notice. If you're not getting emails, if you haven't gotten several emails so far this week, then check with us, let us know. Look in your junk folder, see if they're going there, and then see if maybe your settings are set to not get emails from chains or groups, basically. So just let us know so we can fix that, because we want to make sure everyone's getting the emails from the club. And on that note, I'll turn it over to Pam to just give a little intro. We have a couple of lovely guest speakers tonight.
Oh, okay, thank you, Robin. I want to introduce, I think Dr. Erin Miscioscia is on the call. She's one of the veterinarians that had agreed to speak with us, and the other is Dr. Jennifer Repac. And both of these individuals are specialists in integrative and mobility medicine at the University of Florida. They've helped me out personally with Rhett so that he can still enjoy himself and do all the athletic things that I like to do with him. So they want to define their service. And then the intent of tonight's introduction is to, after they tell you a little bit about their service, to gather a list of topics that we might like to hear more about. And then they're going to come visit us again in October. So tonight will be probably, fairly brief, but just after we listen, I know I have one idea of what I would like to hear more about myself, but hopefully other members will join in too. So with that, I'd just like to introduce Jennifer Repac, and I think is Dr. Miscioscia on the call?
Yes.
I didn't see her. Okay, well, welcome, and thank you both. Thank you both for your time. So I will now mute myself.
Yeah, and if everyone can go ahead and mute themselves, and we'll be patient when you want to ask a question and let you unmute yourselves. But this way, I won't be forced to mute you. I'm muting myself too. Ready?
And if you can enable screen sharing, actually, we have a little slideshow to kind of add some visuals.
And I did type your names in the chat so that people can get familiar with their names as well.
Yeah, it's not letting me, so just let me know when I can share.
Cindy, do you know how to share this? Let them share the screen?
It's usually a setting that the host is able to change. And if not, that's okay.
She's muted, but I think she's working on it.
While we're waiting, so I'm Dr. Erin Miscioscia. Dr. and I are both board certified in canine sports medicine and rehabilitation. So I did my residency training at University of Florida in this specialty. With our service at University of Florida, we integrate in integrative medicine. So we do a lot with nutrition, treating patients holistically. So thinking about just the whole patient. So for instance, we were to see a dog for lameness, we're not only going to address the lameness issue, but we're going to look and see, okay, what supplements and nutraceuticals are they on that might be helpful? Are they getting enough protein in their diet to support muscle mass, to support the joint, that sort of thing. Our service is also in charge of the hyperbaric oxygen chamber at University of Florida, which is a little bit unique for sports medicine as well. Repac, do you want to introduce kind of your training too?
Hi, I'm Jen Repac, originally from University of California, Davis. And I also worked in New York City, where I did my specialty internship and residency training at the Animal Medical Center. I've also did some work abroad as well. I worked in China, and really happy to be in Florida for a whole 4 years now. I also have, in addition to my board certification in sports medicine and rehabilitation, I also am certified in chiropractic, as well as herbal medicine, and all of us are acupuncture certified as well. So I'm happy to go ahead and keep talking, or I can also walk you through how to enable the sharing. It's up
I've
to
made
you.
you guys, I've made you
You're
guys
enabled
co-hosts, so
now.
you can do anything you
We're
want.
good. Perfect. Okay. All right. So now just make sure the right thing is up on my screen. Hold on one second. There we go.
Thank you.
Okay, and then I just have to turn on my presenter mode. How does that look for you all? Good?
Great.
Okay, awesome. So just a really quick rundown. Pictures are always better than lots of talking. So this is both of us. You can see our names. I know we both have kind of unusual last names, so it's good to see them writing. Sometimes we call Miscioscia Shosh for short. And we are the newest college. Our specialty college is the newest college. It's the American College of Veterinary Sports Medicine and Rehabilitation. So we've actually our specialty is only about 10 years old. So pretty much brand new, and a lot of veterinarians don't even know that we are around. So we're very happy to toot our own horns when able to. And so I know most of the time when people hear American College of Sports Medicine and Rehabilitation, their automatic thoughts are these dogs. Don't see many of those in Florida. Or these also becoming more and more rare over time with their racing greyhounds as becoming a rarity with legal restrictions. More and more we are seeing some agility dogs. And we're hoping to capture also more of the kind of sporting dogs as well. We also see probably the majority of our patients are more on the geriatric side and companion animal side. And we also see some working dogs and protection dogs, as well as service dogs as well. So when I explain to others what we do, what does our specialty actually mean? I describe it as that we do mobility medicine for small animals. So we do see some cats too, but they're just not as common as the dogs. And we do also help with the zoo med department too with some of their animals occasionally. So where are we located? Of course, we're at University of Florida in Gainesville. But we also have a satellite location in the World Equestrian Center, just started up earlier this year in Ocala. So on Fridays, one of us is down there seeing cases and doing treatments as well. So a lot of what we do is diagnostics. The first step to any dealing with any kind of patient is we have to understand what is going on with them. And so our most powerful skill, even though we have a lot of fancy equipment, is the quality of our examination. Every single one of our patients gets a general physical as well as an orthopedic, neurologic, and rehabilitation and conditioning exam. We also do a myofascial exam as well. So we kind of joke it's like getting 3 specialty exams all in one because we are so incredibly comprehensive. And so our hands are really the most helpful tool because those kind of help pinpoint where do we need to look next? What do we need to do to help our patients? And so sometimes we'll also use gait analysis. So this is a pressure sensing walkway where this pad can measure the amount of weight in each foot over time. And so that can tell us a number of or quantify the amount of lameness an animal has, and we can use that as a way to see how they improve over time. We also have a static stance analysis where an animal could just stand on one solid surface and we can see how much weight bearing they have in each limb. And so both of these are kind of helpful to see if our treatments that we recommend actually are helpful. And then, of course, imaging is very important for us to help get a diagnosis. And this can be anything from x-rays to CT scan or your CAT scan. We do a lot of CT scans. We're very fortunate to have a service that makes it affordable for us and our clients. And also, when we are not getting our results with some of those other modalities, sometimes MRI is required, especially for spinal cord disease patients. And occasionally we may need to do joint taps to look at the joint fluid, and we'll often analyze these ourselves to look at the cellular fluid or to see how cellular the fluid is. And sometimes we can diagnose some septic arthritises or more immune-mediated arthritises as well. So going on to therapies, we have so many things that we can offer, and sometimes can seem overwhelming. So starting from exercise therapy, that is really the foundation of what we offer. And this can include for conditioning for sport or work, acupuncture, chiropractic and manual therapy, assistive devices, which include braces for sporting injuries, modalities, and we'll talk about these quickly, but laser therapy, electrical stimulation, ultrasound as therapy, shockwave therapy, hyperbaric oxygen therapy, as well as regenerative medicine, which are like in the form of joint injections typically. And as Dr. Miscioscia mentioned, we also do nutritional counseling and supplement plans. So exercise therapy can come in the form of hydrotherapy. I think that's what most people think of when they think of rehabilitation. We have an underwater treadmill. Actually, we have two. And we also have a pool. We're very lucky we have both. So we can do swim therapy or underwater treadmill therapy. And we also have a range of physio equipment to make more targeted land exercise therapy for our patients. For acupuncture, this is actually my dog. Before and after acupuncture, it has quite a great pain relieving effect. We're usually using it for patients with chronic pain, or even we can also use it in acute pain cases for like especially dogs recovering from back surgery. A lot of them get acupuncture as standard of care. And as I mentioned earlier, I'm also certified in chiropractic. This is a joke. This is one of the last times I touched a horse. I don't do a lot of horse work, but we had to do homework on horses for my chiropractic course. But we do something that I do offer. And actually, Dr. Montalbano is our third faculty member on the service, and she is certified in spinal manipulation, which is the equivalent. Also, we do some massage therapy in some of our patients. I just completed a Chinese Tui Na massage course. And so I actually love prescribing massage for my patients. And then going on to assistive devices. So in some of our older or early recovery patients, we might recommend an assistive sling or harness. In some cases that are more advanced, we might need to make a mobility assistive cart for those animals. Also, we might apply a type of footwear for certain types of conditions where slipping might be an issue, and this can really help some of our patients. We also use prosthetics and orthoses with some frequency. So prosthetics are for a patient that had an amputated limb and needs maybe a limb replacement, versus orthosis is more like a brace to support the limb. So going on to therapeutic modalities, laser therapy. I think most people have probably heard of cold laser therapy. We use this a lot for wound and tendon and ligament healing, arthritis, general pain relief. It can help with nerve repair and regeneration. It could also help with more superficial problems like skin issues or ear issues, and sometimes like granulomas. Electrical stimulation is another form of providing pain relief. Usually we can actually send this home with our clients and kind of teach them how to use it on their own animals. It can be helpful for chronic and acute pain relief, and really kind of any kind of condition where you'd be wanting to help with pain. Then going on to therapeutic ultrasound. So this is different than when we usually think of ultrasound where you like can see the baby. This is not a one that you see an image of. Although we do actually use diagnostic ultrasound sometimes to look at musculoskeletal issues. This is actually a different type that is used therapeutically. Much less expensive machine, but and is used to increase blood flow, also decrease pain, and help kind of break down scar tissue and decrease muscle spasm. And it has a good, like a really deep heating effect. We also do shockwave therapy, which is a type of a way of using sound waves, but a much more intense level of sound waves to help stimulate bone, tendon, and wound healing. And this also can be used for arthritis and also back pain. And as we mentioned earlier, we are lucky to have a hyperbaric oxygen therapy unit. So what is hyperbaric oxygen therapy? It's a high concentration of oxygen into a chamber, essentially at 2 times atmospheric pressure. And this could be used for a lot of different things. We most commonly use it for spinal cord injuries. So we're trying to increase the amount of oxygen into the tissues to stimulate healing. So this could be helpful for also wound healing, antimicrobial therapy, or carbon monoxide poisoning, snake bites, post-operative swelling. There are many applications. And then moving on to regenerative medicine, which essentially most of the time is through joint injection. We have platelet-rich plasma, stem cells, hyaluronic acid, polyacrylamide gel, which and other types of hydrogels, which are a newer product on the market, and sometimes steroids that we would inject into joints. And so it depends on the case what we decide. But generally, we're doing this for patients with arthritis, and we're trying to decrease inflammation and pain and delay the progression of arthritis and stimulate healing. Sometimes we'll also inject PRP into tendon injuries as well to stimulate healing. And so here's like an example of us doing a joint injection. I'm going to speed through here though. I know we're a little short on time. And then going on to nutrition, which is Dr. Miscioscia's special area of expertise. And so we unfortunately see a lot of overweight patients. Most of our patients are very overweight. This is actually not really one of our patients, but I got it off the internet. But weight loss is probably the #1 issue that we are nutritionally counseling our patients about, or our owners about. But also we could be looking to improve muscle mass, especially for our sporting dogs, but also our geriatric patients. And also we can use nutrition to help optimize diet for sporting, for different sports, and help with post-workout recommendations, and also different additives or food toppers. So here's an example of some of the supplements that we might recommend. Some are for muscle building, and some are for joint health. And also we offer supplements for brain health as well, especially in our patients with cognitive dysfunction or older dementia patients. But also they can help with pain relief too. And with all our spare time, sometimes we do research. So we have always several clinical trials going on at the same time, but currently we're doing our osteoarthritis trial looking at the pain relieving effects of kratom, which is an oral supplement that's kind of it's commonly used for pain relief over the counter. And we're looking at how bioavailable it is and how effective it is. So this little video here is us walking one of our patients from our clinical trial on this pressure sensing walkway. And we're just looking to see if this supplement helps improve lameness. And then another study that we actually just completed was looking at stretch angles in comparing German Shepherds to retriever breeds. and looking to see if we can use this as a tool to detect a condition called fibrotic myopathy, which is pretty debilitating condition which scars down the hamstring muscles of German Shepherds. And that's our song and dance. We also do a lot of teaching on the side too. We always have students and residents helping run our service, and it is a great happy family. It's a great collaboration between all the different groups in our service.
So we've grown a lot since I did my residency at University of Florida. We now have 3 faculty clinicians. We have 3 resident clinicians, 4 technicians, 2 of whom are certified in rehab. And we're finally grown to the point where we're starting to reach out to groups like you guys, so sporting dog groups, working dog groups in the area, just to see how we can help you, to let you know that we're here. If you have a dog that comes up lame, if you want to try to optimize performance that you think we could help with in any way, we're happy to do little talks like this with specific topics that might benefit the whole groups. We're happy to see individual patients if you guys have any specific individual questions. Really just we're here and wanted to get to know everybody a little bit.
Thank you so
Does
much.
anybody have any questions?
I was just going to ask.
That was a great overview. Really a lot of services that you offer. I don't want to take the floor if someone has questions, but go ahead.
And also just to see what topics you'd be wanting them to expand on, since they have such a wide variety, what, is there something that you would like for them to expand on in next month's meeting?
I'll go ahead with one suggestion, which I think I already emailed, but there's always seems like there are new supplements or changes in what supplements are recommended, or even pain medications that come out. And I would really like to know, get an update on that, like what you recommend, because we all hear things or are told things, and you would be a very good source. I've been helpful with what was recommended exactly for my dog in terms of supplements like the collagens and things like that. So I would like to hear more about that if possible.
I would like a little bit more on nutrition. There's always
Yeah.
so many different opinions on what the best way to feed our dogs is.
Injury prevention. Someone just put that in the chat.
Okay.
Debbie, thank you.
These are all great.
I actually hadn't thought about post-exercise supplements that might be recommended. I hadn't really thought about that. Obviously, people that work out, they use a lot of those pre and post, but I would, that's again, it's back on, nutrition or managing the athlete. I would be very interested in that. And then one more question, when you are at WEC, that is primarily for diagnosis, and then for all of the different things that you do that would require different equipment or facilities, do the animals need to go to UF in Gainesville?
We have almost everything at WEC. We're lacking a few things. So we don't have a hydrotherapy. We don't have a pool or an underwater treadmill for dogs there yet. So if that was something critical for a specific patient, we'd send you to Gainesville to start that plan. But we do a lot of land exercises. We have the other modalities there. Outside of hyperbaric oxygen is another thing that we only have at Gainesville. And then most of the diagnostics we're capable of doing at the World Equestrian Center location. But there are some cases, for instance, if we wanted an MRI, that we might need to send up to Gainesville too.
That's great. So if you had a recurrent appointment for rehab or for some particular treatment, WEC could be possibly the place that we could go. Thank you.
It's been nice to have that option a little bit closer to people, both in Ocala and even as far as the villages, or some people can come from the Gulf Coast over to that location.
Do you have any anything for very young puppies by way of exercises? What's the best way to exercise them? What are the best exercises? So I'd be interested in that.
Yeah, I think I'm kind of getting a couple themes from you guys. So one kind of circling around nutrition, supplements, maybe pain medications, and the other being more
Conditioning.
prevention, like early conditioning or like injury prevention, that type of thing. So maybe we could work on choosing like 2 upcoming dates to talk about each one of those topics. Does that sound good? Is there anything else that I missed that someone?
Would be awesome.
I think the injury prevention would really be great. Like if you're about to run your agility test, or you're getting ready to run your hunt test, you know, what should we be doing to properly warm up our dogs?
Yeah.
And I have a question for possible future, talk. What exercises can we do with our dogs to keep muscle mass in our hips as they get older? That's maybe something they could bring up later on.
Such a common area for our retriever breeds to have issues later on. Absolutely.
Yeah, adding to that, as something like what are some swimming practices that would help keep the muscle there as well? Because I mean, a lot of us have pools that could help, do that at home too.
Thanks, Jenny.
Good.
We may need you back for more than just one more time.
We're happy to help. Like I said, we have a team of 6 veterinarians at this point, so we can, pair off and do a few for you guys. It's not a problem.
One more thing I'll throw out there, maybe some thought giving to injuries that maybe might have to go to surgery, but ways to avoid surgery by rehab. What type of injuries might be amenable to that type of treatment if you wanted to try everything, before having surgery for, cruciate injuries, or there's a number of different things.
What types of activities are most of your dogs doing?
I would
like to
say
answer that one.
people do field training with their dogs, so swimming and running through brush and things like that. I think we also have kind of a lot of people that do dock diving, whether they do it regularly or just, occasionally a few times a year at our events. That's something that a lot of people enjoy, and their dogs, are already used to swimming at home and things like that. What else? Anyone else have ideas? We don't have
agility.
We do have some
Agility.
agility, yeah. So jumps
Great.
and fast turns and
Confirmation.
things
Yeah,
like that.
jumps, turns. We have a few that do fast cat.
Yeah.
Yeah, that too.
Good. Awesome.
Pretty much everything.
And docs, before we let you go though, I'm not trying to end it, but I want to make sure that if we can't wait a month to talk to you, how would we get in touch with you to make an appointment?
For individuals, right? Yeah.
Right. If an individual wants to come to you and go, okay, I'm sold. I know my dog needs to see them now. What would they do?
You can just call the main hospital. So the hospital number for the UF Small Animal Hospital at Gainesville, or the Small Animal Hospital at the World Equestrian Center, and just set up an evaluation. I will also write our service email address in the chat for you guys. So you can reach out to us that way as well.
Oh, and also someone mentioned barn hunt. Thank you.
I'm writing all this down frantically.
Yeah.
Barn hunt. And I will say that our service, we're generally pretty available. I know sometimes universities book out weeks and weeks in advance. We're pretty available, like usually can get in a week or two.
Great. Good.
Even sometimes even within the week. Yeah.
I don't know if you caught the other topic posted about the aging dog and conditioning. Somebody else had a similar suggestion.
That's a good one.
Yeah, very good one. Yeah.
Maybe we could get their contact info and you'd put it out in an email to the club.
Yeah, that's why I'm asking now.
Okay,
Yeah.
thanks.
Yes, thank you.
And you make your WEC appointments by calling the main hospital in Gainesville, correct?
It's actually the WEC Small Animal Hospital that you would call for that one. And I can put those numbers in the
Okay,
I just
perfect.
our service email, which is for either location, but I'll add the phone numbers for both.
Yeah, so for better or worse, they operate pretty separately. So your records are not going to be automatically in both locations. Yeah.
But there's only a few of you, so you would be familiar with us.
Yes, no, yeah.
Yeah.
There's only 3 faculty and 3 residents. Yeah.
Yeah.
Leslie Anderson asked one that I think a lot of us probably would like to do. When we're pulling our dogs out to go run multiple 100-yard marks or blinds, what should we do when we pull them out of the kennel before we send them across the field or across a large pond for these big marks? So how should we warm them up before we throw them in? And then I'll throw in as well, how do we cool them down once they're done? We probably need to do more than just towel them dry and throw them back in a kennel.
Absolutely. Like those are excellent questions. So our general recommendations are more of an active warm up. So that can be 5 minutes of walking and trotting. You can add in some kind of more plyometric exercises, like, sit to stands, down to stands, figure eights, things like that, just to limber the body up a little bit and warm up the tissues. Warmer tissues are less likely to tear, if you think about it, like a warmer rubber band versus a cold one. After exercise, it could be, that's when you want to do your stretching. So, and we can kind of add in recommendations for that. But sometimes those simple things actually can be very helpful for not only injury prevention, but also finding very subtle changes in how your dog is feeling. So if you stretch a certain area and they're sore, then that might indicate to you that they might have overdone it too. So we can go through all of that as well.
Those are excellent points. All right. Anyone have any last questions before we let them go? I wrote down all that contact info there, so we can definitely send that out to the club just in case anyone needs to contact you guys.
We really appreciate you coming on to talk to our group. Thank you very much, and we look forward to the next time.
Thank you.
So nice to meet you.
Thank you,
so much.
ladies.
Thank you.